We are going to be demonstrating cupping to potement today. So I have already made sure that my hands in my area is clean. I position my patient face down, bolster under the ankles, and a face cradle cover for her face. The purpose of potement is to desensitize the muscles, so to relieve muscle soreness, and to also clear the airway. Cupping to potement is used a lot in respiratory therapy for that reason. Some indications for cupping is muscle soreness and respiratory congestion. Again, it's used a lot in respiratory therapy. And some effects of potement is increased blood and lymph flow. You also might see the skin get a little pink. That's okay. Just make sure that it doesn't get too red, because that might mean that your depotement is a little too hard. And you will also have some mucus clearing, so if at any time your patient needs to cough, encourage them to cough. All right. Protocol for cupping is to be undraped, so I'm just going to tuck this into your waistband, Savannah. Okay. If at any time the depotement is too aggressive, or if you again see that their skin is getting a little bit too pink, you can always re-drape their back. Some find it more comfortable that way. Cupping technique, you're actually going to form your hands into little cups, and this is the sound that you want to make. If you hear that sound, you know you're doing it correctly. We want a good percussion and a good rhythm, but you don't want it to be too aggressive. We will, most of the time you'll be doing it on the back and the low back. Just be sure to avoid the area over the kidneys, because the kidneys are pretty superficial to the skin, and percussion is a contraindication over the skin, but you can do this for the full body. I'm going to start off with the back and then do the full body. Again, I start at the head of the table, hands in the cupping. Is that okay? Let me know if it gets to be too much. Avoiding the kidney area. Using proper body mechanics. Avoid the back of the knees as well. Again, good rhythm, good percussion, but it's not too strong. And we're listening for that cupping sound. Then afterwards, just some light effleurage strokes just to calm the skin back down and to know that your patient is done.